Mesothelioma. Surgery. Surgery is the main treatment option for early-stage mesothelioma that has not spread too far. The main surgeries are extrapleural pneumonectomy, EPP, and pleurectomy, decortication, PD. EPP removes the lung, lining of the lung, diaphragm, and parts of surrounding tissue. PD is less extensive and removes part of the lining of the lung and diaphragm but not the entire lung. For both surgeries, nearby lymph nodes are also often removed to check for cancer spread. Surgery often provides the best chance of a cure if all visible cancer can be removed. However, EPP is a very invasive and difficult surgery with significant risks. Radiation therapy. Radiation therapy uses high-energy X-rays or other particles to kill cancer cells and shrink tumors. For mesothelioma, radiation therapy is generally used either before or after surgery to try and kill any remaining cancer cells. It may also be used to relieve symptoms for patients who cannot have surgery such as pain or bleeding. There are two main types: external beam radiation therapy, which comes from a machine outside the body, and intracavitary radiation therapy, which places radioactive material inside the body cavity, often after surgical removal of the tumor. Chemotherapy. Chemotherapy uses anti-cancer drugs that are injected into a vein or taken by mouth. The drugs circulate through the bloodstream to reach cancer cells throughout the body. Chemotherapy is usually recommended after surgery to try and destroy any remaining cancer cells that may have spread. It can also be used for mesothelioma that has spread too far for surgery or as the primary treatment for patients who cannot have surgery. The most commonly used chemo drugs for mesothelioma are pemetrexed, Alimta, cisplatin and carboplatin. Pemetrexed appears to be one of the more effective options. Chemotherapy is often given in combination with other treatments. Targeted therapy. Targeted therapy uses drugs that attack specific vulnerabilities within cancer cells. For mesothelioma, the main targeted therapy drug used is bevacizumab, Avastin. Bevacizumab works by inhibiting angiogenesis, which is the formation of new blood vessels that tumors need to grow. By cutting off the blood supply, it can stop cancer growth. Bevacizumab may be used along with chemotherapy for mesothelioma. Other targeted drugs being researched include ruxolitinib and biomarkers like BAP1. Supportive care. When mesothelioma cannot be cured, the main focus shifts to relieving symptoms and improving quality of life. This is known as palliative or supportive care. Options may include pain medications, oxygen therapy, draining fluid from around the lungs, nutrition supplements, counseling and more. The goal is improving comfort, even if a cure is no longer possible. Supportive care is given at any stage of treatment as needed and also providing along with curative treatment options like surgery. Lung cancer. Surgery for non-small cell lung cancer, NSCLC, that has not spread outside the lung. Surgery to remove part or all of the lung is usually the main treatment option. The type of surgery depends on tumor size and location but may include wedge resection, lobectomy, sleeve resection or pneumonectomy. For small cell lung cancer, SCLC, surgery is rare as it has often already spread by the time diagnosed. Lymph nodes are also often removed during surgery to check for spread. Radiation therapy. Radiation therapy uses high-energy beams to kill cancer cells and targets tumors with precision. For NSCLC, radiation may be given either before or after surgery to try and eliminate any remaining cancer cells. It is a standard treatment for NSCLC that cannot be entirely removed or has spread to other areas near the original tumor. For SCLC, radiation is often part of initial treatment along with chemotherapy, even if the cancer has spread. There are different types of radiation including external beam, stereotactic radiosurgery and brachytherapy. Chemotherapy. Chemotherapy uses anti-cancer drugs to eliminate tumor cells throughout the body and is a standard treatment for lung cancer. For NSCLC, chemotherapy may be given if cancer has spread, either alone or after surgery and radiation. For SCLC, chemotherapy is almost always part of initial treatment even if the cancer has only been found in the lungs because it often spreads quickly. The chemo drugs most often used for lung cancer are cisplatin, carboplatin, paclitaxel, docetaxel, etoposide, irinotecan, gemcitabine and pemetrexed. Combination chemo regimens are usually more effective than single drugs alone. Targeted therapy. Targeted therapy uses drugs that disrupt the inner workings of cancer cells and avoid harming normal, healthy cells. Drugs that target specific molecular pathways in lung cancer include EGFR inhibitors like gefitinib, Iressa, and relatlimab, tarsva, for NSCLC with EGFR mutations, ALK inhibitors like crizotinib, Xalkori, for ALK rearrangements and angiogenesis inhibitors such as bevacizumab for any type of NSCLC. Immunotherapy drugs like pembrolizumab and nivolumab, which help the immune system fight cancer, are also now part of standard NSCLC treatment regardless of mutations present. More targeted drugs are continuously being developed and tested. Clinical trials. Clinical trials investigate new prevention, screening, diagnosis and treatment options, especially in advanced or difficult-to-treat cases. Participating enables access to the latest research treatments and helps further medical progress. Trials combine standard treatments with new drugs, procedures or other therapies and are conducted in phases to test safety, side effects and effectiveness. Patients with lung cancer may wish to explore available clinical trials by speaking with their doctor or searching registries online. Only enrolling on trials approved by hospital ethics boards and not alternative unproven therapies. Supportive care. For lung cancer that cannot be cured, supportive care aims to prevent and relieve symptoms of the disease or side effects of treatment to enhance quality of life as much as possible. Palliative radiation therapy, medications, oxygen therapy, drainage of pleural effusions, nutritional support, counseling and pain management provide comfort, often allowing patients to live normally for a period of time even if cure is no longer possible. Symptoms like cough, breathlessness and pain are main focuses of supportive care at any disease stage. Surgery, radiation, chemotherapy and targeted therapies remain the standard curative and adjuvant treatments for both mesothelioma and lung cancer depending on cancer type and stage. Clinical trials also provide access to newer investigational options and supportive care plays an integral role in management. Treatment plans are individualized based on multiple disease and patient factors requiring a multidisciplinary specialized team approach. Overall, an integrated combination of treatments provides the best chance of success, prolonged remission or cure whenever possible.